మీకు ఎట్లా వర్క్ చేస్తుంది అనే దాని మీద యూ కెన్ గివ్ ద ఎంజైమ్స్. సి హిరుడిన్, అపైరైజ్, ఈగ్లిన్, ఈస్టరేజ్, బెడిలిన్ అండ్ హైలోనడేజ్, హిస్టమినేజ్. And these are the enzymes which will work on the Burgers disease to dilute the thrombus. Burgers disease అంటేనే ఏం చెప్పాను, which will affect medium and small sized arteries, where thrombus will be formed in the small vessels. And diminution of the pulses, blood supply loss అవుతుంది, టెంపరేచర్ తగ్గిపోతుంది, ఎడిమా వస్తుంది, అల్సరేషన్ వస్తుంది, గ్యాంగ్రీన్ వస్తుంది, amputation పోవాలా. These are the things usually sequence it happens. If the leech is applied for 10 weeks, these enzymes will dilute the clot which are there in the endothelium of the artery. They are capable to distract the thing, and gradually within 10 weeks, there will be vasodilatation, clot will be diminished, and see the result. See, this is very interesting, original documented, superior femoral artery and see, this is before study. There is a total blockage. There is no flow at all. See, anterior tibial artery, normal with normal flow, and posterior tibial artery with normal flow. See, now dorsalis pedis. Can you identify dorsalis pedis, anterior tibial, posterior tibial, popliteal, femoral? No, these things in the clinical practice, everybody knows it. And this is the dorsalis pedis is segmental block in the Burgers disease. See, posterior tibial artery with normal flow, dorsalis pedis with segmental block relieved after posterior tibial artery with normal flow. Now, after the leech therapy, blood flow has started. This I could produce, and this was documented one of the best journal in the world. See how we use Burgers disease. I told you, don't worry, keep the hands in the bucket of water and leeches will automatically set. Hold them properly. The only thing how we were practicing on the upper limb. Burgers disease, one of the man who was advised for the amputation of the fingers, he came to me. For 10 weeks, I could able to save his limbs. See, you can see after treatment, the black discoloration has disappeared. After 6th week of therapy, almost they are becoming turning normal. Leech therapy on the foot, they hold like that. Only thing is, at photographic purpose I took, immediately it has to be covered with the water and other things. See, leech therapy in the feet, fully swollen leeches. Vamana karma process is mandatory for your selfish or to safeguard our leeches. Before treatment with gangrene, you can see, with gangrenous finger, and before treatment, you see almost all the foot amputation was advised for this patient. During leaching process, after treatment, you can see fingers are saved, ulcerations diminished, and almost normal. He is able to walk, claudication distance almost normal. One of the another patient, this is ulcer foot. You can see such a big ulcer, it will take to speak very easily, which will take more than 6 months to 1 year. Minimum 3 to 6 months in such a diabetic, especially diabetic. After 6th week of treatment, you can see. After 8th week of treatment, you can see the ulcer almost, that is the advantage over the medication. Medication and leech therapy will minimize the period. That is the advantage. Take advantage from the science. And our recent attempts, I told you, the dimension of leech therapy has changed. Now we are using, for your information, this is a leech ear repair 24 hours post-operatively, 48 hours post-operatively, 72 hours after the earlobe repair, 6 days, 2 months, without antibiotics, without leech therapy. Anybody from, especially the practitioners, young practitioner, I'll give you a chance. What is the condition? This is axilla of a patient. Really, one of the interesting area, looks very simple. Axilla mein gadda jaisa hai. You are from, madam?
I am Dr. Sribala, practicing here in Visakhapatnam.
Oh, fine, madam. Nice, madam.
Graduated from HJCC Chennai and PFL
PG. Good. This is a condition. It is one of the DDs furunculosis, but this is not so. This is really hydradenitis suppurativa, a condition which occurs in the axilla. And once the axilla are swollen, usually refer to a physician, modern physician. He will try with the 4th generation antibiotics. After 1 month, it will be he feel bad, it doesn't respond. He will refer to a dermatologist friend. And with this vigorous referral attitude, he will also try with another 5th generation and other steroids. For 1.5 months, he will get bored. He doesn't respond to a dermatologist. And he refers to a general surgeon who is very active. It will be sent to a general practitioner. He will examine, अच्छा मेरा physician छोड़ दिया, dermatologist छोड़ दिया, मैं तो कुछ ना कुछ. Surgeon, what he will do? He will see and remove all the lymph nodes which are involved, and within it will be fine for few weeks, and the second month again it will be blasted, again it will recurrent. After the surgery, somebody will tell the patient, why you are spending lakhs of amount? अरे उधर पेरुमाल जी है जाना डॉक्टर साहब के पास. And he will come all the way to a Ayurvedic man and do practice leech therapy. It happened for me, the same criteria. And now, good number of monthly 5 to 6 cases of hydroiodinated suppurativa in the practice of my flow. And I tell you interesting thing, my dear friends, young friends, practice karte raho, and when you are successful on 1 or 2 diseases, those diseases will get back. They bounced back like anything to you. I don't know how. Must, you will get back good number of feedback, and patients will come, so many patients. This is a hydroiodinated suppurativa where we are successfully practicing the leech therapy. See, another female patient. This is eczematus, dermatitis, venous ulcer related, cellulitis. Yes, alopecia, hair falling, scalp dermatitis is a crazy thing. Do try with Ayurveda and apply. If it is totally bald, and try to practice leech therapy in such a condition. We have to do prachana and leech therapy. Prachana. See, hair has started growing. This is a varicose seal. Varicose veins are different. Varicose veins are dilated, tortuous, engorged condition of in the lower limb. Long saphenous and short saphenous. That is varicose veins. Varicose seal is dilated pomponiform plexus dilatation. Just keep it that. And we have started doing this. 4th grade, leech, either ek leech. Leech is started sucking the blood, and your patients will be really happy. Even hypothyroidism, goiter cases, safely practice. One of my PG student has done this work. Ulceration, cellulitis cases. This is another hydroiodinated suppurativa. So many patients. You need not, really, how many patients we can document? I need 5 to 10 cases to document. Remaining cases we need not document. Another patient, recent patient, migraine conditions you can practice. And I tell you a clue of practice. If it is by ENT, migraine, no response, try with. Where there is no medicine in the system of Ayurveda or allopathy, there you start doing leech therapy, you will get results. छोड़ दिया गया है allopathic ENT physicians and surgeons, physicians, everybody, and start giving Ayurveda and leech therapy, you will get the results. Yes, this is one of the messages to me, patient after the leech therapy. Hello sir, this is Jagadish, your varicose patient. I would like to thank you for giving me such a wonderful medicine, and wish to share a very happy moment that I am becoming a father. My wife is pregnant, confirmed, and all due respects to your treatment medicine. Thanks, sir. I am leaving some sweets in hospital. See, sweets bhi mil gaya. Kuchit dharmam, kuchit maitri, kuchit yashaha, chikitsa, nasti nishpalam. That's a wonderful thing. When you do the treatment, you'll get the money. You will develop the friendship. You will develop the rapport. You will develop the fame. I also got the sweets. My regards on this. This is only some inspiration. And thank you for your really, my young friends, don't underestimate the science of Ayurveda, the parasurgical aspects. There is a lot in the system. Take carefully, practice judiciously, and you will automatically get the results. Don't disregard yourself. But time, you need patience. To have a good practice in Ayurveda, minimum a decade of time will require. You need patience. Antibiotic practice, this and that, anybody can flourish. Okay, initially to survive, anybody has to. But once you are attaining maturity, stick on to Ayurveda, promote Ayurveda, and you will be. Money is not a big thing, I tell you, friends. Money is not a big thing. When I was a assistant professor in the department, I got an invitation going abroad, collecting bank loans and other things. Initially, people were laughing at me. Mutiji might be knowing. And when it became I'm habituated. And then I started practicing. So really name, kvachit dharmam, kvachit maitri, kvachit yasha, chikitsa, nasti, nishpalam, it comes. Money is not a problem. You do get it. It will come. Don't worry. Money is important criteria for anybody for the success rate. Without money, talking is useless. When you are successful, by all means, talking on any arena, and definitely I wish, and definitely you are definitely going to wonderful practitioners.